Welcome again to another episode of Conversations with Dr. Pete. I am Dr. Lethabo Machaba, and today I've got one of my favorite guests, Onkgopotse Khumalo. She is a well-rounded mother and also a big pioneer and trailblazer in the tech space concerning motherhood. And she also has a mother's group that she actually founded and is pioneering at the moment. Welcome, Onkgopotse. How are you?
I'm well, thank you. Thank you for having me.
Good. You know what? I'm so happy to have you because when I met you, you had just had your little one.
Yes.
And can you just tell me a bit about that motherhood experience? Because that was your debut into doing this woman and motherhood thing.
Yeah.
Yeah.
Yeah, it's so interesting because when you met me, I was going through a lot. I think the motherhood journey for me was exceptionally humbling.
Yeah.
I had no idea what I was walking into. I think I oftentimes say to my mom and, older women in my life who have had children before me and raised and now, had older children by the time I had given birth.
Yeah.
Why didn't you tell me? Why didn't you warn me? Because then I think, I think I would have taken a bit more time, right?
Yeah.
And I think for me, it was very different to what I had envisioned, especially because it was during COVID. It was already embarking on the journey of motherhood can feel incredibly isolating, especially when you're like amongst the first of your peer group to have a baby. Right?
Yeah.
So nobody really gets it. You don't get it until you get in it and you're experiencing it. So you kind of just already it has a component of it that can feel isolating. Then you throw on COVID. And where isolation was, the name of the game for the sake of protecting, ourselves, our health, and our families. And what it did for me was just make what was already a difficult experience even more difficult. I have not given birth outside of the COVID experience. So I don't have a comparison, but I know for sure that it was an exacerbating factor that made it more difficult. And so what I started doing during COVID was just leveraging social media to talk about my experience in earnest, because I think what we were being served was this very idealistic picture of what motherhood looks like neutral tones and, matching nurseries, and it
Precious baby.
and those things can be true. But there's also a duality that you learn to appreciate is that you can be, incredibly excited and blessed and honored that you've been given this mantle of motherhood while still holding the tension that it's difficult. And I think what emerged from my vulnerability in that process was that a lot of people were afraid to share the difficult parts because of the shame that might overcome them and the judgment, where people would say, well, you chose to become a mother, so now you deal with it. Other people can't, don't have the blessing of being able to become a mother, so be grateful. And so what it does is it encourages a lot of self-silencing. And I just wanted to break that mold.
You know what? I'm so thankful that you actually took that initiative because, with me, I always talk about my conversation and my experience of actually being a motherless mother where I grew up. My mom died when I was young. So when I did step into motherhood, even as a pediatrician, I'm not going to lie to you, I took a knock. It was the most life transcending transition of just actually realizing that it's an unknown territory. I didn't know what was right, what was wrong. I knew medically what was right, what was wrong. But the experience of it, of actually what to buy, when to buy, and how to balance things, that was quite challenging for me. So can I ask you, in the fact that you've started even a mom's group, what are some of the questions that your moms are asking you? The challenges, common challenges that you are finding runs a thread in most of your conversations?
Sure. There's so many, but as I'm hearing you speak, I'm thinking about three things.
Yeah.
The first is nannies. and childcare. I feel like we could have a whole series about nannies and childcare because I kid you not, I think I went through, and this is a safe space, right?
Yes, it is a safe space. Yeah.
I think I went through like 13 nannies.
Wow. To comfort you, I know one of my moms who went through 32.
Okay. So
32, so you can feel comforted.
She's got the world record.
Yes, yeah.
I think I went through 13 nannies, and I think it was just a function of so many things. So a lot of the questions that will come through are like, any tips and recommendations, how best to look out for the right one, what are the early signs that the nanny might not be the right one, and all these questions around childcare. And I think, so I started the group, I think a year into my motherhood journey.
Yes, and well done for that.
And it wasn't like anything that I wanted to necessarily create a huge spectacle of, but I just wanted to create a container for moms.
Yes.
And soon to be moms to come together and feel seen, heard, and understood, right? Because it's very difficult to walk into spaces and let's say you're breastfeeding. And you start leaking, right? You're out, you're at a wedding, now you're leaking. And to say like, to ask for help. Like you don't really know who to ask.
Especially when you don't have an outfit change.
You know?
And you can't just leave the wedding.
No, you can't leave the wedding.
They haven't said their vows yet. You need to finish.
The wedding is in Franschhoek, it's far. So if you can find a space very quickly and put the questions out there, knowing that they'll be received without judgment, knowing that they'll be received from the perspective of a group of people who also understand because they likely have experienced it themselves or they just carry a grace for you because they are mothers themselves.
Exactly.
And what I like about it is like, I never touted myself as any expert, just somebody trying to figure it out. And I just started inviting mothers, soon to be mothers that I knew or asking the mothers that were then in the group over time, extending them, the opportunity to invite others. I kept it intentionally small. And only really started opening up a little bit more after about 2 years, really. There's the things that we discuss and the questions that are posted in there. There's a sensitivity and there's a vulnerability in that. And I just wanted to honor that instead of making it like this massive thing. So childcare
is one of the...
But definitely.
And I must say as well, even with us, I always get during my consultations, can you recommend another? Everybody always feels that there's a better nanny out there. And I feel that because they are not such a professional space in South Africa, most of them don't get training. And we find that they don't even have CPR or first aid training. So in the case of an emergency, they don't know what to do. They don't even not even been given emergency numbers to call.
Exactly.
So I feel that as well, as parents, we have a responsibility that even if we find them untrained, to train them. But if there is a mismatch, what do? Move on quickly because it is your child. You need to provide protection to your family and your child. And then any other topics that you help?
It was childcare, health, and obviously that's your forte. And then
but we're so thankful for you guys to actually drive that conversation, because I know you also run a medical center, isn't it?
Yes.
So at least that helps because you are able to see some of the medical conditions coming through there.
Yes. So health was definitely one.
And is this children's, baby's health or mother's health?
I would say mainly children's health.
Yes, okay.
Which was quite an interesting insight as well, because I think a lot of us might be familiar with the quote, everybody wants to hold the baby, but who's holding the mother?
Oh, wow.
And,
that's profound.
I've seen, you see these clips on social media and they're like, where, people come in and the mother's just given birth and they all just rush to see the baby.
Yes.
But then there's some clips where like the mother of the one who's just given birth or the sister goes straight to her because it's like, who's holding the person who's given birth?
Yeah.
And so I feel like there's a lot of like, we ask all the questions, what's the right food, solids, whatever, for the baby, and oftentimes we neglect ourselves and our health questions. So that in and of itself was an insight for me around like, why are we not also integrating our health and our recovery as top of mind?
Yes.
Because if you can't, if you're not your full self and if you're not healthy, then you can't give of your best.
You can't love somebody else unless you have loved yourself.
Pouring into yourself.
And you can't overflow if you're empty.
Exactly.
And I find that as well. We are just running this motherhood journey with a lot of exhausted, depleted moms.
100%.
And then they go into physical ill health. We see that as doctors. Then they go into mental ill health. And, and it's just then chaos. Because if you don't have a woman in a society, I mean, there is no pillar. Yes.
Listen, and so I think that again is also, and we'll probably touch on it later, is like this self-silencing around like everybody else's health or everybody else's pain or everybody else's exhaustion being elevated above our own. So that was an insight. It wasn't necessarily a question or something that was obvious in the group and the questions, but it was something that I was able to glean. And then the third thing was sleep, which is related to health. But
the sleep is, it's an entity.
It's like I just need a moment for the sleep topic. And I think for me, especially because it has such a sore place in my heart.
Yes.
I just try and create space and share information and for how to navigate that piece.
Yeah.
My son, so he was, I breastfed primarily and then exclusively because he was struggling with allergies and the like. And I don't know if that had something to do with it, but he just would wake up every 45 minutes to an hour for maybe 18 months straight.
Sure.
And so the sleep thing is almost like, I just want to help other moms and other parents. I'm not an expert by any stretch of the imagination.
And we want the real advice and tips that these moms and parents can actually use. So what did you do in that case? What did you find helped you?
It's such a good question that you're asking because I did a couple of things and there are a couple of things I only learned after the fact.
Okay, yeah.
So the one thing I did was, because I was that mom that just wanted to know everything about everything. I read all the books and I was just to the point of like analysis paralysis and extreme overwhelm.
Yes. And I'm sure with smartphones and online and Google and all of that, the information just keeps coming. Because I find that when I'm panicked as well, even though I'm a medical doctor, I do that. Because now I'm trying to listen and hear another voice. Sure. Sometimes you think the Americans have the solution. Because you feel like everybody I'm talking to and all the knowledge I have is not solving this problem. And now I am about to become delirious because I haven't been sleeping.
Exactly.
And, I find that I then become snappy. I shout and, and so what are the tips that you feel help? And then I'll share some of the tips I see some of my moms at the practice, the ones that I feel they have used and it worked for them. So in your case, anything that you feel worked or you felt like nothing worked?
There were times where I felt like nothing was working. I will be honest. So it was the one thing I think that transformed everything was learning to listen to my own voice.
Okay.
And tapping into my own voice.
Okay.
And very practically what it looked like was, I gave the example of, I breastfed pretty much for 2 years.
Yes, yeah.
And that was a function of circumstance. But I think everybody was saying, you've got to do this and you've got to do the cry it out method and then you've got to put the baby in the cart and leave them. There were so many things.
Yes.
And I was like, well, you know what? Right now I'm breastfeeding and I'm going to co-sleep. And there was so much research at the time that was like very
anti
co-sleeping. And I had initially carried so much guilt about why I'm not just forcing the independent sleep thing.
Yes.
But it just was not working for him.
Yeah.
And it was not working for me.
Yes.
And so I think the minute I brought him into the bed probably created habits that made it difficult along the way.
Yes.
But I got more sleep because I didn't have to get out of bed to go to the other room to get the baby, like rock him to sleep infinitely and then put him down, only to have to come back 5 minutes later and do the same thing.
Yeah.
So for me, it's less about that practical thing is a function of tapping into my own voice.
Yes.
Like everyone,
exactly.
almost everyone in the research community and whatnot at that time.
Yes.
Now things have shifted, but it was saying, you know, do the cry it out method, leave the baby to cry, do all these things. And that's fine if that works for you.
Exactly.
And if your intuition you've tapped into your intuition and that's the message you're getting. But that was not the message I was
what?
getting.
I really like that because I have a mom. She wrote a story in the book that I authored, The Secrets of Superpowered Moms.
Okay.
And she was saying that as well, trust your instincts. She said that she had a baby with seizures. She writes her story. And then she said that for the longest time, she knew her child has a seizure, but everybody was telling her that there is none of that.
Wow.
Until then, she actually eventually found me as the ped. And then that's how I said to her, I said, no, let's get you into your peds neuro. So I really like that because I find that there's a lot of literature out there. We know as doctors, American, like the Australian sleep guidelines will tell you baby must lie flat, facing upwards with no toys and just a little cloth, or a blanket covering them halfway through their bodies. And then we always get questions, Doc, can I swaddle? Can they sleep on the side? And all of that. And I really believe just because in the essence of this conversation, do trust your instincts. Do check with us. Some things might not necessarily be in a guideline, but they're not so bad. Culturally, African women have co-sleep with their babies. Yeah. We know the guidelines say no, but this is where we can guide on how to safely do it. Maybe swaddle the baby, put the baby in the recovery position, and make sure that there is another person looking out for you to make sure that you're not, if you're sick, So, no, I'm so happy that you actually brought this up because we have mommy guilt, even us as doctors in South Africa having to advise different cultures. It becomes very challenging. It becomes very challenging. And that is why I like to have these real conversations because we need to know what mothers are actually doing out there and the real challenge. Because if we don't speak into that, we are not going to bring about any problem solving. If every time we are only going to talk about this is how things should be
done.
We should actually be able to address and say, what are you doing? How can I meet you halfway? And how can I support you? And then you know what, Onkgopotse, I'm so happy as well that you then became also an innovator. And then you came up with the tech, because now you saw that there's a struggle. So maybe in your own words, what initiated that, the mental health? If I do understand correctly, it is a mental health app.
Yes.
So what actually brought that initiative and innovation about?
Yeah. So it's very interesting that you were touching on like cultural resonance. And it plays a very big part in my story and how I got to building the app. So for context, Amari Health is a holistic well-being platform where we connect individuals and organizations to mental health and health experts.
Oh, wow.
And tools.
Yeah.
So how it began was, I think it was around 2018.
Okay.
And I myself had, this was pre-baby, was working an extremely high-pressure job. I was working really long hours, and this had been the case for about 2 years.
Yeah.
And one day I was driving, and I just had to stop. My body was essentially telling me, no. So I had this debilitating stomach cramping.
Oh.
So it's so debilitating that I had to stop. I said, if I keep driving, this is not going to
happen. You might end up in an accident.
Exactly.
Yeah.
And so fast forward maybe 3 weeks later, I find myself in a hospital bed. Maybe I've lost 10 kilograms.
Sure.
I'm on the road to recovery.
Yeah.
But what I initially thought it was, being very physical, it was manifesting as very physical. I had very painful stomach cramping.
Cramps.
I saw the gastroenterologist and whatnot and all these things until a specialist physician.
Yes.
I remember he sat at the edge of my bed.
Yeah.
This was, I think 3 days into all the blood testing. And he said, you know what? I think you should see a psychologist.
Sure.
I think you're extremely stressed. I think your body is just pushing back on the stress you've had it endure.
Yes.
And it was such a strange response because I was like,
I feel it.
But I feel
the
it.
symptoms.
And at the time, I wasn't who I am now.
Cramps. And I'm sure, I don't know if you had a bit of acid reflux, maybe some symptoms of that, where you're feeling a bit of heartburn and coughing.
Everything that was like, I was convinced that it had to be a definitive physical diagnosis that I could put in front of, whoever and say, this is what it was.
And you want medication to treat everything, one or at least maybe two
symptoms,
medications that will treat what I have. Because don't you feel like when people insinuate that you need to see a psychologist, it's like saying that you have mental issues.
Yes.
And none of us, we power strong women don't want to hear that.
Yeah.
You don't want to hear that you're actually having a meltdown.
Devastated.
You're having a burnout. Your world is falling apart and it's all in your mind, and then the mind is manifesting.
Yeah.
Yeah. So did you get help?
I did. And then it was the first time that I started venture. It was the first time I saw a therapist.
Yeah.
It was the first time I began understanding therapy and psychology. And in that process, I speak about how coincidentally in that period in my life, it was like God was really pointing at this thing because I lost a really good friend to suicide. And it was on the back of this, admission.
So it's in that season that she killed herself.
He
killed himself.
So he died by suicide.
Oh, no.
And I was...
Sorry about that,
we were all obviously very taken. This is an extremely, exceptional, by all intents and purposes, human being living the life. Like exceptional career in London. And we were the same age.
Yeah.
And what it made me do, I wouldn't encourage people to do this, but, and we can get into that later, but I quit my job and I just said, obviously this is not working because I am on the path of self-destruction, clearly. And I took some time to think about what I could do about this. And one of the first things I came into contact with was how difficult it was to even find a therapist.
Yeah.
The second thing was how difficult it was to find a therapist that I felt I could relate to.
Yes, yeah.
I at the time wanted to see a Black woman.
Yes.
And then also how expensive it was. Sorry.
Yeah, yeah.
So I ended up spending a couple of days in a psychiatric retreat.
Yes.
And I think when I heard the cost of that whole thing, thank God I'm on medical aid, but I realized that how many people don't have access to this.
And was your medical aid willing to cover that cost?
Yes.
That's amazing, because some medical aids don't have that.
No, they don't.
They don't have that as a benefit.
Not at all.
Wow.
So I then said, okay, how can I create access to care pathways that are culturally resonant, that are convenient, and that are cost effective?
Okay.
And that's how Amari was born.
Oh, wow.
And I found that even when I got back to work, I was struggling to make time in my diary to leave the office to go to the therapist, have my 1-hour session, then come back. That whole process is 3 hours, basically, if you're stuck in traffic both ways. And I said, as a high-performing, super busy, it's very difficult to commit to something that takes 3 hours out of your day. It just is.
Yeah.
And so I thought, how do we bring this into a virtual concept so people can do it in a car, in their office parking lot if they have to.
Exactly. Or even at home breastfeeding in case of postpartum depression. Yeah.
Yeah. And I thought the last thing you want to do when you're in a depressive episode is leave your house.
Yes.
You don't even want to switch on the light.
You don't. And the thing is, you could actually self-harm after leaving the house, because now you have no support system. So the driving could be crazy. And we actually spoke about this in a different episode, how when people are going through a meltdown or mental ill health, they tend to lean into addictive behavior or addictive substances like alcohol, drugs.
Exactly.
And it's the reality of the situation, So then tell us then a bit more about then how does it work? How do we access it as parents, as moms, as doctors?
Yeah. So it's a web app. So you can access it at amari.health. But there's also WhatsApp pathways. So you can WhatsApp and we pay you with, well, the algorithm pays you with a therapist that aligns with your preferences and the like.
Yes.
And what I really like about how it's built, and it's obviously we've iterated and we've pivoted over time, is that we really think that, you know, mental health and wellness in general is not a one-size-fits-all approach.
Yes.
So it's not delivering answers to you and hoping that you resonate with them.
Yeah.
It will prompt you to say, like, it'll ask you a few questions. Obviously, we've integrated some AI elements into it, which we can get back to later. But what are you experiencing right now?
Yes.
What are the things that you're really struggling with? What kind of, you know, coach or therapist do you think you would resonate most with right now? And then pairing you with the skills, tools, experts that make sense for you or to the best of our algorithm and our team's capability. Because one thing we've learned is that often people give up on a solution, a possible solution, because the first try with a therapist went horribly wrong.
Yes.
And now therapy is demonized in their world.
Yes.
So we try as possible to tailor solutions to the problem, so to speak. How we initially went about it, and which is the core thesis of our model, is businesses. So we essentially offer our platform to businesses that want to invest in their mental wellness of their employees.
And is it like a subscription or a retainer fee?
Yes.
Okay.
So it's a subscription model per employee per month.
Yes.
And depending on obviously the organization's budget or what they're solving for, there's a basket of services that are available, even now up to in-person healthcare checks biannually. And it looks quite different from how it did in the beginning, because what we realized is that it's more systemic than we thought it was.
Yes.
That the best way for us to scale is by leveraging B2B rather than going B2C.
B2C,
and also, I think we really wanted to educate and empower employers and leaders with the resources and the know-how to understand the ROI of investing in mental health.
In mental health.
It's not well understood. It's much more well documented now. But even so, you have to bring this story together around how, you know, the opportunity cost of not investing in your middle manager's mental health is that they could leave 2 months from now.
Yes.
And the replacement cost of that is on average anything between 80,000 and 150,000 Rand. So how do you proactively invest in your employees, your teams, your leaders, so that you can mitigate against that?
Yes.
You want your people to show up as close as possible to the best version of themselves, right?
Because then they can be productive and the company can be productive.
Right.
Yeah.
So that's how we kind of remodeled and pivoted into something a little bit more different, but the heart remains the same.
Yes.
How do we help people live happier, healthier lives?
Yes.
And my heart, obviously, being a mother, being a woman, is a large part of what we do focuses on women.
On women, okay.
Sadly, but also, you know, around 70% of our users are women.
Okay.
So, which I guess the irony is, you know, as a doctor, that the suicide rate amongst men is 4 times that of women. But women are the ones seeking out help. So we're still trying to understand, you know, what we do in that space. But if you have a heart for something, you figure out your niche, you figure out where to kind of position yourself. What's working is working for this group. But maybe at some point we'll get to that answer. But the heart remains. I'm particularly passionate about is women, especially in the postpartum phase.
The postpartum phase.
And that's just because I am her, right?
Exactly.
And it's so much easier.
We are her.
we are her.
Yes,
so to pour into somebody else who is you is a lot. It comes a lot more naturally.
Yeah.
Yeah.
Sure, Onkgopotse, I really love this conversation. And I wish we could talk for days and for hours.
I have questions for you.
There's so much more that I want to hear. But you know what? I'm so happy that in this conversation, we've actually been able to be introduced to Amari's Health, yes.
Mm-hmm.
And, you know, to my parents out there, to anybody listening to this podcast, I would really appreciate it if we can tap into this. What's nice about this is you don't have to show forth to a human being in person. You can do it anywhere in the house. And as you said, it's so scary, the statistics that men are 4 times more likely to commit suicide than women. And they don't seek out help more. It's the women who are seeking out help. So really, and thank you so much for sharing from your story and just empowering each other as women and as a community. And me being an employer as well, I'm empowered to actually look at this product and get it for my employees, because I feel that it would improve the quality of care for my patients and also for me in general, because if they're happier, the office environment is less hostile and we're happier.
Yeah.
So thank you very much. And yes, and that is it from us concerning mental health issues, concerning just being a mom, and as well community impact and empowering others.
Thank you. Thank you for having me.